Like many aspiring physicians, I felt called to a career in medicine, yet knew little about what I was getting into. My first medical school interview was with an amiable rheumatologist in a charmless office at a large, run-down urban hospital on a corridor tucked behind an industrial-sized kitchen. As I came in the main entrance, wearing a new suit, I noticed the peculiar corrosive smell of hospital disinfectant, saw elderly patients on gurneys, and felt sad and confused inside. At the time, I couldn't articulate why. The interview was relaxed, friendly, and seemed to go well, which put me in a better mood. Getting to this point had been a long and difficult road for me, so I had every reason to be excited. As I headed home, I was able to push out of my consciousness the unease, bordering on dread, that I'd experienced before the interview. But I sensed it would return. I'd actually had more experience with healthcare delivery than many aspiring physicians. In high school, I trained and worked as an emergency medical technician on a rural volunteer ambulance squad. I once performed CPR on a farmer who had aspirated chewing tobacco, pushing hard on his chest while trying to keep my balance in the back of the van as the driver, with sirens blaring, whisked us to the emergency department. Shortly after we got there, the man was pronounced dead. I wondered if maybe I could have saved him if I had known more. In college, I observed and studied healthcare in the developing world, spending the summer after my junior year shadowing physicians at clinics and hospitals in Nepal. Throughout, I strategized about what I needed to do to become a doctor. Getting into medical school became an obsession. Yet, once on the threshold of entering the profession, I wondered silently if I was making a mistake. What hung over me was the feeling that I didn't know if I would be happy with my chosen vocation. I recalled going to see my pediatrician in high school, in a nice office where he saw kid after kid coming in with colds and for school physicals, and feeling a disconnect between what I imagined his job was like and the excitement of being a doctor. His demeanor, which seemed fatherly but distant, may have contributed to my misgivings. It was a trepidation that felt shameful to articulate, as I had already embraced the identity. After all, being a physician is supposed to be a privilege as one acquires the knowledge and skills to cure disease and alleviate suffering, and becomes privy to the intimate lives of patients. While I could exude confidence and enthusiasm about where I was headed, inside I felt like someone who sensed they might be marrying the wrong person. It's taken me years to understand the source of the ambivalence I felt at the time. Joy in medicine requires more than idealistic aspirations. It requires a capacity to see past the otherness that separates the well from the sick, the old from the young, the professional in a white coat from the disheveled patient in a hospital gown, and fully embrace their shared humanity. And at that stage in my career, I didn't have that capacity. When one is unable to bridge the divide between doctor and patient, medicine becomes a career rather than a calling. Medicine as a career is about advancement, status, fitting in, making money, finding job security, and working reasonable hours. For some, it's also about the intellectual rewards of learning new procedures, guidelines, and research related to patient care. In addition, most physicians enjoy the human interaction with patients and consider it a central part of their professional identity. But how many are capable of relationships that are mutually nourishing? Few are, it seems. The irony that pre-meds are often the last people you'd want to turn to in a time of need became evident to me in college when I first learned about the selection process for a peer-to-peer support program. The Campus Counseling Center ran an off-hours service where students could meet with other students to talk about loneliness, depression, relationship problems, or anything else on their minds.